Hello everyone and welcome to today's presentation. I'm excited to have you here. Today we'll be exploring gout arthritis overview. We'll look at what gout arthritis is, its causes, symptoms, and how it can be managed effectively. So let's dive in and learn more about this common condition. Let's take a look at the main causes of gout. First, uric acid buildup is a primary factor. Gout occurs when there's too much uric acid in the bloodstream, which can lead to the formation of tiny crystals in the joints. These crystals cause the intense pain and inflammation we associate with gout. Next, dietary factors play a significant role. Consuming foods that are rich in purines, things like red meats, seafood, and certain alcoholic drinks, can increase uric acid levels. When these levels rise too high, it can trigger a gout attack. Finally, genetics and family history are also important. Some people are naturally more susceptible to developing gout due to their genetic makeup. If gout runs in your family, your risk is higher, so understanding these factors can help in managing or preventing the condition. All these causes are interconnected and highlight why managing diet, understanding your genetic risk, and monitoring uric acid levels are crucial in controlling gout and its symptoms. Let's take a closer look at the symptoms of gout. First, acute pain is usually the hallmark. It often strikes suddenly, and the pain can be quite intense, especially at night when you're least expecting it. This sharp pain is a key indicator that something is happening in the joint. Next, we see swelling and redness. The affected joint doesn't just hurt, it also becomes swollen, warm, and visibly red. These signs point to inflammation, which is part of the body's response to the uric acid crystals forming in the joint. Finally, gout is known for its recurrent attacks. These flare-ups tend to come back over time, and importantly, they can become more frequent and severe the longer the condition goes untreated. Recognizing these symptoms early is crucial in managing gout effectively and preventing joint damage. Let's start by talking about the physical examination. When diagnosing gout, doctors will often perform a thorough physical check. They'll look for signs like swelling and redness in the affected joints, which are common indicators of inflammation. At the same time, they'll review your medical history and symptoms to get a complete picture. Next, there's joint fluid analysis. This is a key step because it provides a definitive diagnosis. The doctor will extract a small amount of fluid from the swollen joint and examine it under a microscope. If uric acid crystals are present, it confirms gout, helping to differentiate it from other joint issues. Finally, blood tests are also part of the diagnostic process. These tests measure the level of uric acid in your blood, which can indicate your risk of developing gout. However, it's important to note that during an acute attack, uric acid levels in the blood might actually be normal, so this test alone isn't always conclusive. Together, these methods, physical exam, joint fluid analysis, and blood tests, form a comprehensive approach to diagnosing gout accurately and guiding effective treatment. When it comes to treatment options for gout, there are several approaches we can take. First, medications such as NSAIDs, colchicine, and corticosteroids are commonly used to help reduce pain and inflammation during an attack. These are usually the first line of defense to manage symptoms quickly. Beyond medication, lifestyle changes play a crucial role. Losing weight, staying well hydrated, and making dietary modifications can all help lower uric acid levels in the body. These adjustments are important because they not only reduce the frequency of gout attacks, but also support overall health. In the long term, medications like allopurinol may be prescribed, especially for those who experience recurrent gout. These work by lowering uric acid production, helping to prevent future attacks and manage the condition more effectively over time. Connecting this to our overall theme, effective management often combines immediate symptom relief with strategies that target the root causes, promoting better quality of life and reducing the risk of future episodes. Let's start with prevention strategies that can really make a difference. First up is a healthy diet. Adopting a balanced diet that's low in purines is crucial. This means avoiding red meats, organ meats, and certain types of seafood, as these can increase uric acid levels. By making mindful food choices, we can help manage and prevent gout flare-ups. Next, regular exercise plays a vital role. Engaging in consistent physical activity helps us maintain a healthy weight, and that's important because excess weight can put additional stress on our joints and increase the risk of gout attacks. Finally, hydration is key. Drinking plenty of water helps flush out uric acid from our bodies. When we stay well hydrated, it reduces the chance of uric acid crystals forming and causing painful gout episodes. By focusing on these strategies, healthy eating, staying active, and staying hydrated, we can better control uric acid levels and support overall joint health. Living with gout means actively monitoring your symptoms and understanding what might trigger flare-ups. Keeping track of these details can really empower you to manage your condition better and seek medical help right when you need it. It's about being proactive and aware of your body's signals. Joining support networks or support groups can make a big difference. Connecting with others who are going through similar experiences provides emotional support, practical coping strategies, and valuable advice. Sometimes, just knowing you're not alone can be a huge comfort. And of course, regular checkups are a cornerstone of effective gout management. They help your healthcare provider keep an eye on your uric acid levels and make necessary adjustments to your treatment plan. This ongoing care is essential to keep your gout under control and prevent future flare-ups. So, by monitoring symptoms, leaning on support systems, and staying engaged with your healthcare team, you're taking important steps towards living well with gout. Managing gout arthritis is really about more than just medications. It's about understanding how it can impact your daily life and taking proactive steps to control it. Gout can significantly affect your quality of life, making simple activities uncomfortable or even painful. But the good news is, with the right approach, including lifestyle changes and proper medications, you can really make a difference in managing your symptoms and reducing flare-ups. Education and awareness are absolutely crucial because knowing what triggers gout and how to prevent episodes empowers you to take control. When you understand your condition better, you're more likely to follow through with management strategies and maintain a better quality of life. So, the key takeaway here is that effective management isn't just about medications. It's also about being informed and making healthier lifestyle choices. That's how we can truly improve outcomes and help people live more comfortably despite gout.